Hello, my name is Andrew Rowe, and I am presenting on the Substance Abuse and Dependence Assessment with the CSL 643 Appraisal class taught by Dr. Elliott. When looking at how this assessment was created, it looked at the overall need for assessing substance abuse and dependence of populations. This assessment was created to better assess the dependence and risk behaviors of clients, as well as determine if there's a need for substitute medication, also determining the level of competency regarding parenting and other responsibilities, ensuring that clients are able to maintain daily responsibilities, or if they require additional assistance through maybe a treatment center or some other form of recovery. I liked this idea of an assessment because it requires a holistic approach where it looks at the full person while still incorporating empathy and minimizing any judgment. When looking at the idea of population, I noticed that there is no distinct group of people who suffer from substance abuse. I know that there are specific age ranges that suffer from higher uses, such as cannabis and alcohol are used by ages of under 18, where heroin is more commonly used with adults. And although most drug misusers use a range of drugs, heroin seems to be the largest drug use. But overall, I did not discover there to be any specific gender or race that had higher numbers of drug use history. Looking at the basic implementations of this assessment, there were 5 areas that this assessment covered, which was the current drug use and alcohol use, which looked at what drugs were currently being used, how often they were being used, and how are they being provided. The second was the assessment of risk. So are they overdosing? Is it being misused? And are there other people at risk, such as children and level of contact with children? And the assessment of social function. So is the house being taken care of? Are they employed? Is there a relationship that is going through domestic violence in result of drug use? Is there a financial burden being caused by the use of drugs? And is basic childcare being provided while this substance use is happening? Basic implementation is continued. Also, there's an assessment of the criminal involvement in offending. So are there any current arrests or previous arrests that are caused by or a result of drug use? Any outstanding warrants with possession charges, things like that. Then we look at the charges themselves. Are they on probation? Have they been imprisoned, or do they have any fines through the court? Assessments of physical and psychological health, so presenting physical problems and symptoms and diagnosis, current prescriptions, whether prescribed or not prescribed, and if those prescriptions are being taken as prescribed. Also looking at psychiatric history and current symptoms, so if they are previously diagnosed with any psychiatric things, and if they currently show any symptoms of new developments. A history of accidental or deliberate overdoses. It also looks at the sexual history and any STIs or sexually transmitted illnesses that could have been done, and also looking at allergies and sensitivities. When looking at the validity and reliability, I saw that this assessment focused on a specific topic, so it looks directly at substance abuse dependency. So with having distinct direction, it shows that it has good validity in how it is used to obtain information. This assessment looks at the person, which means it wouldn't be used to compare with other people, but it could be used as a tool in grasping higher numbers of different drugs being used in an area or different age ranges. When looking at reliability, this assessment uses connected tests such as urine, saliva, and blood tests to better look at alcohol levels and different levels in a person's system to determine how often they're taking drugs, what drugs are being taken, and what levels they're at to determine their dependency on those substances. Some strengths for this assessment is it focuses on the drugs and how it affects the individual. It's a broad view of the current medical and psychological issues, and it's a broad assessment to better understand the client's current use and dependence. I took away that the weaknesses, it does not go deeper into the individual history to address trauma, but instead looks at the reason for drug use. This assessment doesn't look at family history. It doesn't include the focus of trauma. So when looking at the whole person and the reasons for use, it doesn't seem like there are a lot of psychological reasons that drive a better understanding of why a person might choose to use. I thought that this would be a good alignment with Freud's theory in that it assesses the idea of what a person looks to use for, so the reason for using, identify areas of drug use and what those reasons are behind the drug use, assessing sexual involvement and reasons for seeking pleasure, and it also looks at the areas of a client's basic needs, such as housing, food, financial, and those different areas. And that is my presentation on the substance abuse and assessment portion.